Good morning. How are you doing today?
Good. How are you?
I'm good. My name is Megan. I'm going to be your nurse this morning.
Sounds good.
I'm here to give you your morning meds and to check your vitals and things like that.
Okay.
You in any pain this morning?
No, I'm not.
All right, good. Well, let me first of all verify your information here.
Mm-hmm.
Can you tell me what your name and date of birth is?
Sure. My name is Tom Smith. My date of birth is March 14th, 19XX.
All right, thank you. All right, let me look at your chart here, and actually before I begin, I'll wash my hands. Okay. And let me look over at your chart. Do you know if you are allergic to anything?
Yes, I'm allergic to sulfa.
Okay, let me double check that on your chart.
Okay.
And yes, it does have here that you have an allergy to sulfa, so I'm going to make sure to note that. All right, before we begin, let me just kind of run over your list of medications. You've got the Advair, which is the inhaler, and you take insulin for when your blood sugar is low, and you've got lisinopril, which is for your blood pressure, and then you've got heparin as well. And I'm going to, before we get your medications, I'm going to check your vitals because there's a couple of those that are dependent on what your vitals are. All right?
Okay.
So I'm going to begin by taking your temperature.
Okay.
Just put that on your tongue.
Mm-hmm.
Okay. And that is at 98.4, which is normal. And I'm going to check your blood pressure right now. Push the button on the machine and let that go. And while I do that, I'm going to look over your morning labs, and it looks like your glucose was at 110 this morning, which means I don't actually have to give you your insulin, because your insulin starts at 111, or 111, so you're good to go for that. All right, it looks like your blood pressure is reading at 120/98, and you are to receive your medication, your lisinopril, whenever your blood pressure is over, the top number is over 100, so we are going to take that this morning. Your pulse is at 72, your pulse ox 98%, respiratory rate is about 17, so all of those other vitals are looking good this morning. All right, so if you will just give me a moment, I'm going to go get your medications, and I'll be right back.
Sounds good.
Pulling my patient's medications from the Pyxis machine. So I'm going to begin by logging in with my name and my password. I'm going to choose my patient, who is Tom Smith. And the first medication that I'm going to be pulling for him is his Advair, which is fluticasone 100 micrograms plus salmeterol 50 micrograms, 1 puff daily. So I'm going to click on one of those, and the drawer will open, and I'm going to pull out the discus, and it has on here 100 micrograms plus the 50 micrograms. I'm going to verify that that's what that is. The same label is here, and on the MAR, I'm going to place a sticker on it and set that aside. I'm going to close the drawer, and I'm going to click on my patient again, and the second medication I'm going to pull is his lisinopril. So I'm going to click on that, and that is in tablet form. He needs 20 milligrams this morning. It comes in 10 milligram tablets, so I'm going to click that he needs 2. And the drawer will open, and I will pull out 2 tablets. And I'm going to read on the label. They each say 10 milligrams, 10 milligrams. I've got 2. 10 milligrams of lisinopril on here, 2 of them, and he needs 20 there. I'm going to place them in my cup. I'm going to put the label on, and set that aside, and shut the drawer. Click on his name one more time, and now I'm going to get his heparin. So I'm going to click on the heparin. He needs 5,000 units this morning, given subcutaneously. It comes in 5,000 unit vials, so I'm going to click that I need 1 of those. And the drawer opens, I'm going to pull out that vial. It says 5,000 units per milliliter of heparin here, 5,000 here, 5,000 there. So I'm going to label it. Set that aside and shut the drawer. And now I'm ready to return to my patient. All right, Mr. Smith, I'm back. Got your medications all ready to go. Gonna verify one more time for me your name and date of birth.
Sure. Tom Smith, March 14th, 19XX.
Good, thank you. All right, so I'm gonna wash my hands again. And I'm gonna put on some gloves. And we're gonna verify your medications one more time on my paper. I've got your Advair, which is for 100 micrograms and 50 micrograms, and that's what's on here. I've got your Lisinopril, which is 20 milligrams. I've got two 10 milligram tablets, which you will take by mouth. And then I have your heparin, which is 5,000 microunits subcutaneously, and that's what's in this file here. That's what's on your papers. I do need to double check with another nurse, though, to sign off on the fact that we've got the heparin here. So this is where I would have another nurse come in, double check, and sign off for me. All right, so we're going to begin with, I'm going to get all my supplies here. Okay. And I'm going to begin with the heparin, which is a little bit of a shot. I want to get the worst part over. And draw the milliliter. Alright, and this is going to go in your tummy. So, I'll put up the shirt here. Clean up the site. Before I do that, however, I'm going to remove the blunt tip I used to withdraw the medication. And this is where I would put on a 25 gauge needle for the injection in his subcutaneous injection. Alright, so alcohol's a little bit cold. I'm going to pinch the skin and inject. Alright, doing okay?
Doing good.
Alright. Next, I'm going to give you your Lisinopril, which are tablets, but before I give you that, I would like you to take a drink of water for me, just to make sure you're swallowing okay this morning. All good?
All good.
Alright, can you take both pills in one shot?
Sure.
Okay, so do that.
Okay.
Got it?
Got it.
Good, good. Alright. And lastly, we're going to do your inhalation, which is your Advair. And it comes in a little disc that you're going to inhale in. So I'm going to slide open the disc. I'm going to push the button to get the powder ready to go. Now, the way this is going to work is I'm going to hold it up to your mouth and you to put your lips on it. Take a deep breath in. Before you do that, though, I want you to exhale all the air out. Then we'll take a deep breath in. You're going to hold it for 10 seconds, and I'll count with you.
Okay.
Just make sure all that medication gets in your lungs.
Gotcha.
Then you can breathe out, and then I'm going to give you a sip of water to swish around and spit out, because you don't want any remaining powder to remain in your mouth.
Okay.
All right? So if you're ready, go ahead and
Ready?
breathe out. Okay. And breathe in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. And I'm going to give you a sip. Don't swallow this though, just swish it around. You can spit out in there. Alright. Good. Feeling okay?
Feeling good?
Got any questions for me?
Nope, I think I'm good.
Okay, do you need anything else while I'm in here?
Nope, I am fine.
Alright, you have a good morning. And
Thank
I
you.
will check on you later, okay?
Sounds good.
All right,
Thank you.
thanks. Bye.
Bye-bye.